Okay, so welcome everybody to Coffee with Fellows, which is the new webinar series from the Centre for National Training and Research Excellence in Understanding Behaviour. So we have two brilliant speakers today, both of whom are fellows here at Centre UB. So I'll waste no time in getting started with the introductions. First up, we have Dr. Marie Dunnion, who, having worked initially with the Cerebra Network as Impact Lead, is now a Centre UB Research Fellow with the Cerebra Network. The Cerebra Network aims to improve health and wellbeing outcomes for neurodivergent children and children with rare genetic syndromes. Marie's Centre UB Fellowship project focuses on the network's research impact on children and families. Also today we have Dr. Zhaozhang, who is also a research fellow, and her research is in health communications here at Centre UB. Her research sits at the intersection of digital health communication, chronic disease management, and behavioural health interventions. Today, she'll be sharing her experiences leading interdisciplinary health communication research and offering reflections on how communication can be reimagined to improve public health outcomes. So without any further ado, I will hand over to Marie to begin her presentation.
I'm told that you can now see this, so welcome and thank you for coming along to hear more about this presentation on co-designing a novel Cerebra Network podcast. It's called From Research to Reality in Rare Syndromes. So I thought I'd start with a little bit about me, but it's not going to be 15 minutes of my autobiography. But when I was putting this together, I just thought that there were little bits of the story missing. And I think I was assuming that you would know who I was. So I thought, OK, I'll frame it. So basically, after completing my PhD, shortly afterwards, I had my first child and not long after my second. So you can see my firstborn on the right and my daughter on the left. That was a recent trip to Cadbury World, although chocolate is available. And I then had a 5-year career break as a parent carer. My son is autistic and he received his diagnosis shortly before his 4th birthday. I'm not just giving random facts here. This is all feeding into the podcast narrative. So this then led me on to research and learn a lot about autism and special educational needs and disabilities. And that's where my research interests moved from my PhD area of business psychology and then led into neurodiversity and resulted in past and present roles working for the Cerebra Network. So you've already heard of the Cerebra Network via the bio at the beginning, and obviously the title of this presentation. So who are they? In brief, because we haven't got long, the Cerebra Network basically pioneers translational research in 4 key areas to support neurodivergent children and children with rare genetic syndromes. So you've got a visual pyramid on the right-hand side, which shows autism at the top. It's in no particular order: behaviours that challenge, sleep, and mental health. And essentially the focus is on these 4 key areas because they are known to lead to poorer child and family well-being. And they've just been the areas that have been highlighted as key concerns for families. And something else which is pertinent, especially when I come on to talking about how I've carved out the podcast between the universities which comprise the network, is you can see all of these logos at the bottom right-hand side of the slide. Sorry, I tried to say side and slide and it didn't work. You've got the University of Birmingham, you've got Warwick University, Aston and Surrey, and roughly each university can be mapped onto each key area or vice versa. So the University of Birmingham, their expertise is in sleep. Aston University, mental health. The University of Surrey specialises in autism or autistic characteristics, and something called diagnostic overshadowing, which is when basically it can be quite difficult to differentiate one condition from another. For instance, if someone has a rare genetic syndrome and is also autistic, and behaviours that challenge map onto Warwick University. So that's a very whistle-stop tour, but it just gives you that background to help you understand what I've been doing with the podcast. So last year, when the Centre UB advertised their fellowships, I put in my application and had one of these wonderful long-winded titles, Delivering National and International Impact on Practice for the Cerebra Network. So I essentially proposed 3 work packages. I'm only talking about one of those today, but this just gives you, again, overview. It's all about the overview in the background today. So the first package is what I'm talking about today, which is this novel podcast series whereby I'm translating the network's research for family carers. And the podcast itself is called From Research to Reality in Rare Syndromes, as it says in the title. There is a second work package, which is kind of the second and third are in the background, like spinning plates in the background at the moment. And that one is focused on a new continuing professional development training module in behaviours that challenge to form part of the teacher training resource. And the third work package is again looking at CPD training for health professionals via another one of the Cerebra Network's websites, which is the Further Inform Neurogenetic Conditions website, or FIND for short. And rather than put in hyperlinks, I've tried to make it easier by just popping down the website addresses there. So like I say, the current fellowship focus, package 1 of 3, is on the podcast, which is a novel podcast series to translate research on rare genetic syndromes into resources, with the focus being on family carers. So like I've said, there are websites which education practitioners can access and health professionals, but the network really want a resource that is especially for family carers, where there is a real need for this information. And often family carers don't have a lot of time because of the nature of their caring responsibilities. So today, a key strategy of the Cerebra network has been knowledge exchange via written parent-carer guides, which they've developed with their funder Cerebra, and you can see some of those on the right-hand side. And this is just 3 of a multitude. You know, they cover anxiety behaviours that challenge, self-interest behaviours. But like I say, family carers are often short on time. So my fellowship project aims to make the network's research as accessible as possible by delivering an 8 podcast series, like I said, primarily for family carers and for the real life benefit of their children. So it's having this real world benefit. So just trying to represent that visually by having all that information from the guides, you know, moved into podcast form. So when people are driving safely, they can listen in, or when they're cooking. The podcasts are going to be half an hour to 40 minutes. So they're not going to run over an hour. They're going to be something manageable for families to listen to and get some really quick and useful tips. So something that was really important from the beginning was to embed what's often called patient and public involvement in my fellowship. So my application at the beginning stated that I'd work closely with NHS and education professionals and PPI groups to ensure that all resources meet the needs of key stakeholders. I know there's issues with abbreviations like PPI and stakeholders. They're not my favourite words, but you know, that those are just what I'm using for the purpose of what I'm trying to communicate quickly. So to achieve this in relation to the podcast, and bearing in mind that, you know, time is often not something that's on our side, I haven't been able to, you know, hold lots and lots of focus groups, but have facilitated a 1-hour online focus group with 5 family carers to capture their lived experience of rare genetic syndromes, because it's really important for us as a network to capture that rich lived experience and use it to inform what we're doing for family carers. And also, you know, as ever, it's hard to get everyone in the same place at the same time. So where people couldn't attend the group, I invited them to speak one-to-one. So I spoke one-to-one with one family carer and had that focus on a specific rare genetic syndrome. So it was quite nice to get that group discussion experience versus the sort of more one-to-one discussion experience. And then we've got a hub at the Birmingham, at the University of Birmingham, on public patient and public involvement. So it's also great to have those resources as well to draw on. So that's just a quick insight as to what I was asking for when I invited people along to the focus groups. You know, a person with a rare genetic syndrome. But as it happened, everyone who attended was a family carer, and they came along to talk about the podcast topics. And the way that worked was the podcast topics were initially decided in collaboration with all network leads. There are 4 network leads, 1 for each university. And you can see on the right what those topics were. So, for instance, at the University of Birmingham, we have 2 podcast episodes dedicated to sleep, because there's a lot of research about sleep, 1 on pain and self-injury, 1 on behaviours that challenge. Aston has done an episode about mental health. We've got 1 from Warwick about something called the Checklist Project, which focuses on behaviours that challenge. Warwick is going to be doing an episode on family carer wellbeing and covering the Push Project, which looks at parent carer wellbeing specifically in relation to GP surgeries. And we have Surrey talking about autism and diagnostic overshadowing, which I've already mentioned. So you can see there's a lot being covered in just those 8 episodes. So obviously we can't really talk about research which we don't already have. So what I did was I brought those proposed topics along to shape the online focus group narratives with family carers, to ensure that what was being discussed as part of those episodes is of real relevance and use to families. So reassuringly, the focus group confirmed the relevance and helped to inform the podcast script questions. So I didn't word for word write what we were going to say in the 30 or 40 minutes that we're speaking in a podcast, but obviously it just helps to have that framework, to have spoken to family carers, to have gone away, incorporate what's been said into questions, which then me as the host of the podcast can put to the guests that are speaking, guests including professors, early career researchers, staff at each of the universities I've mentioned, family carers. So we've got a real range of guests, which is great. So I'll not read all of this out, but this is just going back to the focus groups again. I explained to family carers, that I was inviting them to think about their own lived experience and asking what they thought would be most useful for other parent carers to learn about in order to better support their children and families. And at the end, just to check, I did ask whether they thought there was any significant areas that I might have missed that parent carers would benefit from hearing about, and just added that perhaps it wouldn't be possible to cover all topics in depth in this podcast series, but suggestions would be incorporated where possible. And then some input that I got back, and which was really useful. This first speech bubble relates to a discussion about sleep, and if a family was thinking of starting to change their approach to their child's sleep patterns, one family carer said to think about, how is this going to affect you and other family carers? Are you actually ready to do it yet? And if you're not ready, there's no point in making everyone's life a million times worse in trying to change something. So just think about the timing of bringing in those changes. And somebody pointed out, it might not be the case of doing something entirely new. Think about what's worked in the past and perhaps bring that back if you stop doing it. So just moving quickly on, because I'm aware of time, one of the Centre UB fellowship requirements is that we have an external mentor. So I'm working with a programme director for mental health, learning disability and autism for the NHS. And that's just been really valuable in terms of getting input to that PPI, being able to share that invite, going back to my mentor after the PPI groups and just discussing some of the themes which arose, like personalisation, dual diagnosis, family carer wellbeing, practical issues about the format of the podcast, and thinking about when it would work well to discuss topics in terms of host, an academic and a family carer. And content, I think from early on, it became evident that rather than having an episode dedicated to each rare genetic syndrome, for instance, one that might have focused on Angelman syndrome, another on Smith-Magenis syndrome, not taking that approach, but rather, like you've seen, having that approach whereby cross-cutting themes across syndromes form the focus of each episode. And it will be useful, obviously, having the mentorship there in terms of future promotion of the podcast on NHS platforms. So this is just a mock-up of the artwork when we get to that point of using Buzzsprout as a platform and releasing episodes roughly perhaps every 3 weeks. So for instance, this is thinking about the episode on sleep with Professor Caroline Richards, who's my internal mentor at the University of Birmingham, and just promoting that as an episode which explores sleep with Professor Caroline Richards and Dr. Rory O'Sullivan, and providing practical tips on how parent carers can improve their child's sleep. And then just to give some fun visuals, this is what's been going on during March and April. So the recording started in March and is set to conclude in May. So on the left-hand side, top left, we can see Rory with Leanne Stevenson, who joined us to talk about sleep in relation to her child who has Smith-Magenis syndrome. Dr. Stacey Bissell's at the bottom left-hand side, talking about a little bit more about sleep. Like I say, there's lots of sleep research, and we had Dr. Kelly Wade talking there, again, the sort of left-hand photograph on the right-hand side, talking about pain and self-injurious behaviours. And on the right-hand side, you can see some pictures. I'm talking to Lauren Gregory and Denise Bain about a project called the I Know Project, which focuses on behaviours at challenge. So there's a lot of projects being covered as part of the podcast as well. And the bottom right-hand photo, you can see Professor Caroline Richards hidden in the corner, but that's her recording her episode on sleep, which will be the first episode that's released. So just to quickly conclude in one slide, which is quite difficult, but thinking forward to impact and implications, the Cerebra Network's first podcast is intended to generate a novel impact. It represents the network's first use of this digital media to extend reach primarily to family carers, which I've said many times, but it will also benefit health professionals, education practitioners, academics, and behavioural researchers. But what we're mainly hoping for is that it will impact on families and their children's well-being. You know, for example, helping to improve sleep. I'll try and just mention sleep a few more times before we finish. Helping with parental mental health and well-being, which, like I've said, is the focus of one episode. And just also having that reach to clinicians, educations, researchers, and others who wish to learn more about rare genetic syndromes and the wide range of topics covered in the podcast series. So that just leads me on to the QR code for the Cerebra Network, but you'll see that that's got a website address as well. And if you go there, there's links to all of the resources that I've mentioned today, and you can follow us on Facebook as well. So we'll have questions at the end, which I look forward to answering. And just thank you for listening.
Oh, thank you so much, Marie. Yeah, just while we're switching over to Zhaozhang, if you've got any questions, can you please pop them in the chat or use the Q&A function? As we will be answering all the questions at the end, if you can start your question with the name of the speaker, it will just help us if it's a sort of more general question, which could direct to either of them. So I will now hand over to Zhaozhang.
Oh, hi, good morning, everyone. I'm Zhaozhang San. It's really great to join this webinar and meet you virtually today. Today, I'd like to share some insights from my PhD and my fellowship project using health-related influences as a lens or angle to discuss their potential in health communication practices. And also, I can also do some review and tell you about the potential of communication in public health research and behavioral science research. So let's start. This is all the things that I would like to cover today. I'll start by setting the scene, then introduce what I found in my PhD research, and then following on my current fellowship project. Finally, I'll just share some reflections on doing the interdisciplinary health communication research and wrap up with a bit of time for questions and discussions. Yeah, so just give you a brief introduction of myself. I studied media and communication in my bachelor's and master's. After that, I became an international journalist at the national media. And then I decided to do my PhD in health communication. After that, as a research fellow in health communication and behavioral science, I mainly focus on exploring the potential of social media platform, new technology, and digital health influences on people's health-related knowledge, attitude, and behaviors, especially in the context of diabetes. So in this section, I'll just give you the key terms of my research project background, health communication and social media influences. Firstly, let's look at what is health communication. From this diagram, you can easily see that health communication is just like where communication and health meet. So communication, from my understanding, is just like sharing information, but it's not only about sending the message to the person. So it's about creating the shared meaning between peoples. You can use communication as a tool to take actions, sharing or express your needs and building understandings. So this means in health communication related research, we can think that the difference between health communication and communication is that it focuses not on communication in general, but specifically on health related issues and contexts. Well, when it comes to, you can say that there's one well-organized and recognized definition of health communication. As researchers highlighted that one of the most essential goals of health communication is to persuade the targeted audience to change their behaviors or beliefs towards certain health issues. That's also reveal the importance of effective health communication. So since the main purpose of the communication is to exchange or transfer the information in the forms of thought or the knowledge, we can say that communication is effective only if the message is correctly communicated or interpreted by the receiver, and they use this information to improve their knowledge or change their behaviors. That's the background of health communication. And also there are some principles for effective health communication. Well, why I would like to think influence in the context of health communication, because communication process is really complex. Every part of this process, no matter the senders, the receivers, the channels, the message top, or any feedback, could affect how the message is understood and whether it has any impact or even have no impact on people's understanding. So from this perspective, also with the development of social media, we can easily see that the way that people communicate with each other has been changed, and social media provide the way for people to look at or reach to information related to health. But it has also got some disadvantages, such as their varying quality and consistency. And also, if you are living with certain health conditions, you may feel there's some private concern for sharing too much information online. So that people or social media users may think that information online, also on social media, is not trustworthy. So they need to find someone who to trust to obtain the information and to inform their certain health-related behaviors and knowledge. That's why social media influencers comes. They can, from previous findings, they are a group of social media users that has a large number of followers. They are highly respected, connected, informed, and exposed. Their audience consider that the information disseminated from those influencers are trustworthy, and they can use their impact and influence to influence their audience buying behaviors. So based on that kind of understanding, I'm just thinking whether I can use the social media influencers in influencer marketing or in advertising, use their potential and impact to say whether they can use them there in health-related context for promoting or encouraging or helping people to adopt health-related behaviors. That's my previous thinking. So I just use the diabetes as one of the lens to explore this problem. All this background information bring me to my PhD study. So I'd like to examine whether social media influencers could offer a way for health communication practice, and especially in managing chronic conditions such as diabetes. So there's 4 major research questions in my PhD study. Identify the key social media influencers, knowing what diabetes-related narrative do they present on social media platforms, and then what factors may impact their online communication practice, no matter that's internal or external. And finally, what's the potential implications of those narratives presented by influencers on audiences with diabetes-related knowledge, attitude, and behaviors? So there's some key findings based on my PhD study. Firstly, health-related social media influencers is a distinct group of influencers. They're not the same as commercial influencers in health-related contexts, because their power doesn't come from being popular or only have a large following base. It comes from being credible, informative, and relatable. So in my research, I found that diabetes-related influencers, both individual and organizational, they're not just sharing the information, they're shaping how people feel, think, and talk about their lived experience. And they also create online community and offering some emotional support. But that's the kind of advantages. But their online health communication practices also influenced by many factors, and their impact is not unlimited. Although my findings show that they have potential impact in influencing people's knowledge and attitude, but they have limited impact on changing people's behaviors. The major factors influence these findings is that there are several internal and external factors influencing, like the organizational goals, the personal experience, and audience inequality. For instance, the socioeconomic inequality or the diabetes-related stigma. So based on that, all my PhD findings, it comes to my current fellowship project. I've already know that diabetes-related stigma is a major obstacles that impact the effectiveness of health communication practice, and influencers have the potential to influence people's understanding and knowledge. Then whether I can use those influencers in my project to design a strategic digital influencer intervention to address type 2 diabetes related stigma. So that's coming from my PhD idea, and then to my current project review topic. Well, there are 3 major phases for my current project. First one, the narrative review to understand what stigma is and their manifestation, and also their results or influence on people's living current life. And then the effective communication strategies that might be useful to reduce the diabetes stigma. And then I invite people living with type 2 diabetes, the healthcare professionals, and also communication and marketing and campaign experts to develop a campaign handbook using the co-design workshop method. After that, after they build the campaign handbook, I just share it with the social media influencers in diabetes context who are voluntarily to join this project. And they help us to create the content, launch the campaign, and then I'll evaluate the impact of this campaign in reducing diabetes stigma and fostering community engagement using qualitative and quantitative method. Well, currently, I finished the literature review, and I was in the process of co-design workshop. there are 74 individuals have already signed the consent form and would like to join the co-design workshop. And also there are 5 leading academic professors and communication directors agreed to join as an external advisory committee to provide some feedback and also to check to maintain the quality of all the material created before the launch of campaign. Well, so hopefully the campaign will raise the awareness, start conversations, and help reduce the stigma around type 2 diabetes. And for the long term, I aim to support the better management or even influence the policy in this area. Well, based on my fellowship project, that's my reflections. Firstly, influences just came from top animal. So in my project, all those stakeholders play an important role in designing this campaign and also helping us to evaluate the effectiveness of this campaign. And also if the influencers would like to influence their audience in those campaigns or even in online spaces, they need to be willing to learn and be influenced based on this project. And also this kind of co-design method is like a co-creating a process of influence, meaning, and knowledge. So that's where role change might happen. Finally, in this section, I would like to share some of my reflections in interdisciplinary health communication work. Firstly, I must say that interdisciplinary project matters because complex problems like the diabetes are so complicated. They are not just about biology or medicine. So they also need to involve how people think, feel, and behave, and how society treats those people with health-related conditions. And health communication provide a way for me to connect all those understanding from communication to social science to public health and even to behavioral science. Well, from my background in communication studies, I learned to know that communication is a complex process. Oh, sorry, it's a complex process. Yeah. So we cannot if we want to change someone's behaviors, we can't just say do it. We need to carefully think about what message we're sending, who is going to, and how it will be delivered and when. So I always think, oh, in this process, who is speaking, who is listening, what's this message meaning to them? And second, I can use the communication-related theories to understand those social or individual-related behaviors, such as using the theories like agenda setting theory, framing theory, or the innovation of the diffusion of innovation theory. And finally, I would like to the communication study enable me to understand more on audience voice, emotion, and their decision-making process from a whole context perspective. And later, what health communication and behavioral science added to my study is obviously that it asked me to focus more on evidence and impact. So after knowing more about public health and behavioral science theories, I learned to think, did those interventions improve people's well-being? Did it really reduce certain risks or diabetes stigma? That is measurable. How could I measure that? Use those method in public health and behavioral science. So that helps my research grounded, measurable, and even maybe much more impactful. Okay, so finally, I'd like to share that when those different discipline meets, great things can happen, but it's not always easy. For instance, we learned different theories, method, and sometimes we even use different metrics to evaluate whether it works or not. So in communication studies, maybe I can say that this campaign is success only if I got the more loads of clicks, likes, and shares. and people in social media shows their positive emotions. But in public health, we want to see some actual behavioral changes or clinical improvement, like more people are getting screened or better blood sugar control. So that's not the same, and it's not that easy. But after I do these two projects, I really think that the interdisciplinary method can help me to answer those specific questions, and all this understanding can help to refine the current understanding in both area. Yeah. So looking back in my work so far, there's some final things that all the personal reflections that I would like to share. The most important one is I much more think that influence isn't about disseminating, just sharing. It's about co-create meanings. And if you'd like to ask if there anything you'd like to provide for some interesting idea in interdisciplinary project, I'd like to share those things, such as what happens when ChatGPT became your digital public health advisor, and how could you use that to improve the measurement of treatments of diabetes or any other health-related issues, no matter that's that's depression or psychology, or even just trying to lead people to take certain actions. Yeah. So if you'd like to keep in touch, collaborate, and you're interested in my fellowship projects, here's how you can reach me, and wish you a wonderful Friday. Thanks.
Great. Thank you, Zhaozhang. So I'd like to just quickly thank both of our speakers today. And that is the end of the presentation section of today's webinar. And we'll now move on to the Q&A.